Hi, I'm Shannon. I'm a registered dental hygienist. Today I wanted to answer a few questions that I get from my patients about fluoride varnish. First, and I hear this a lot, it's like I brush with fluoride toothpaste and I have fluoride in my water. Why do I need fluoride varnish? So there's a term called substantivity, which basically means that it sticks to where we put it. With the water, water is systemic fluoride, which is very different than topical fluoride. And the toothpaste kind of is in and out of the mouth pretty quickly, so you don't get a lot of effect from that. Whereas the fluoride varnish actually sticks to the tooth, and it can give you benefits for several months, actually. I hear sometimes, well, isn't fluoride just a gimmick? We're trying to take my money. But actually what we're trying to do is save you money, because if we're being preventative, we can help not only try to prevent the cavities, but we can keep the cavities that are there that are small, and sometimes they can even remineralize or harden. So, this is something that we do to try and save you from having to do expensive work. 3, if fluoride's so important, why does my insurance not cover it? So insurance is a business, and they do not have the licenses that we have. It's like when you go to the pharmacy and they've denied the medication that the doctor thought would be very helpful for you because it's too expensive. They don't have to pay for it, so they're probably not going to. Unfortunately, they don't consider preventative as important as we do. And a lot of people think that fluoride's just for kids. So when children are growing and their teeth are growing, they need fluoride systemically, which means that they're drinking it in the water or they're taking the fluoride pills, because that's building the tooth strong from the inside out. But we eat and drink a lot of things that break our teeth down from the outside in. So we need to have the topical fluoride as adults so that it can keep them strong and reduce the decay rate. And then, there's been a lot of question about, isn't fluoride toxic? People read the blaring headlines. First of all of the trials and studies that have been done using systemic fluoride, like the fluoride that's in the water, and at very high rates. So even water is toxic at too high of a level. So it's not a matter of it being toxic at the levels that we use. And the fluoride varnish is even less risk because it is applied directly to the teeth and stays in the mouth and stays in the tooth. So it's not going through your whole system. If you have any other questions, please feel free to ask your hygienist, and hope to see you soon and get your fluoride varnish.